Hello, I'm Dr. Michelle Retz, Naturopathic physician here at Ethos. My specialties and areas of focus include chronic GI and digestive concerns, mental emotional issues involving anxiety, depression, bipolar, PTSD, and endocrine issues involving the thyroid, the adrenals, and women's health concerns. I treat menstrual issues, PMS, PCOS, and menopause, as well as autoimmune concerns. Most of my patients are chronically sick. They've come from all over, they've got specialists, they have many physicians, they've been to Mayo, and for some reason still feel like they're not improving. Many of them may feel like they're taking too many medications or having side effects from medications or want to wean off a few or all of those medications. They might just also want to have a conversation about natural alternatives to their health concerns. On the flip side, they might refuse to participate entirely in the traditional medical model and just want to use naturopathic care for their health concerns. They could be new to town, looking for a new physician, a new PCP, someone to do their annual labs, physicals, well woman's exam, etc., or sports physical. But all of them are feeling frustrated, dissatisfied, marginalized, curious about other options, desirous of a conversation about what alternatives are available to them. They want to have a conversation with their doctor. They want to feel understood. I've wanted to be a doctor since I was 8 years old. My parents' professions were in arenas that allowed me to be around the traditional medical model, but what was most impactful to me was my mother. She was a chronic pain patient, and I would say the 1% who got sick when the wind blew the wrong way. So my early subconscious upbringing involved a day in the life of someone who was very ill, going through the traditional medical model, which allowed me to observe where it's really strong and excellent at patient care, and also where it's really lacking. I came to understand later as I began to choose a more holistic health career for myself that bedside manner was the first and foremost priority for me. I truly feel that psychological healing happens before physical healing when someone feels listened to, cared for, and heard. I very much am the doctor that's going to let you curse, cry, let it fly around the room in the way that you need to because that's our space. And I'll also be the doctor that comes around and gives you a hug if need be. I've been bringing this powerfully holistic medicine to people for 11 years since my residency. I teach gastroenterology at Southwest College of Naturopathic Medicine. I was the chief medical director of Doctors Without Borders, Naturopaths Without Borders for 5 years. I speak Spanish and I love helping those communities as well. And I'm a board member for the Therapeutic Heart Foundation. My new patient visits are 90 minutes long. All of my follow-ups, acupuncture visits, and perineural visits are 45 minutes, which ultimately means I know my patients very well. I'm known for being anal and thorough. I believe in doing it right the first time so we don't have to go back and repeat it later. So if what you're hearing is what's missing in your healthcare, first of all, I'm sorry. Secondly, I'd like to thank the doctors that you do have for doing the best they can for you in the paradigm they're in. We all have your best interests at heart, but what's most important is that you resonate with your physician. I want to hear your story, help uncover the stones to your illness and why you're not better, and help you remember what you're here to do. I look forward to speaking with you.